Good afternoon, Salamat Sore. I wanted to introduce myself and welcome you to this afternoon's talk. My name is Professor Donald Shepard from Brandeis University near Boston, Massachusetts in the USA. Our talk this afternoon will be on the cost-effectiveness of Wolbachia against the Aedes aegypti mosquito when implemented at scale in Indonesia. We'll have three presenters this afternoon after my introduction. The first will be Dinar Karisma from Brandeis University. The second will be Nandi Wilasto from here at Gajah University. And the third will be Dr. Ida Sufatiri from Dr. Sarajito Hospital, also in Yogyakarta. In my couple minutes of introduction, I wanted to give a few highlights of what we'll hear presented this afternoon. The first part on the cost of dengue is based on interviews with patients across three settings: hospitalized setting, ambulatory, and a setting that's sometimes overlooked, the non-medical setting where patients treat themselves. The hospitalized sector, of course, is the most expensive, and we found that one episode of dengue when hospitalized costs about 4.8 million rupiah, which is equivalent to $343 US. This amount can be roughly divided into four components. About 1/4 of this is paid directly by the household involved. Another quarter roughly is paid by the community, the family and friends of the person hospitalized through a contribution. The third quarter is through Indonesia's remarkable system of national health insurance. This country is among the leaders of low and middle income countries of having a comprehensive and well-functioning system of health insurance. And the last component is through other collective payments, particularly government subsidies. The second part of the talk relates to the cost effectiveness of Wolbachia when implemented at scale. Wolbachia is a remarkably promising technology that is likely to be able to control dengue as well as other diseases transmitted by the same mosquito, such as chikungunya and Zika, by inhibiting the ability of the mosquito to transmit these viral diseases. Our role on this has been to look at the economics, the cost of Wolbachia when implemented at scale, the economic value and health value from it, and relating those two in terms of the cost effectiveness. Starting first with the city of Yogyakarta, we found that extending the Wolbachia program to the city of Yogyakarta would cost about $4 million US. While that seems like a large amount at first, it would provide protection for many years, perhaps 10 years, maybe even longer, against dengue, saving hundreds of lives each year. In economic terms, this can be expressed as a cost-effectiveness ratio, where we look at the cost of saving 1 year of healthy life. We found that for Yogyakarta, that cost effectiveness is about $1,000 US. To interpret that, the World Health Organization has suggested that this ratio could be compared to the country's per capita GDP. In the case of Indonesia, that number is about $4,000 US. And so 1 year of life can be saved at only about a quarter or perhaps 30% of what 1 year of good health will bring to the economy. That makes it an extraordinarily good value. And then furthermore, if you calculate the savings in medical costs, the Wolbachia program would actually pay for itself. The money saved in healthcare, which could be turned to other problems that Indonesia will increasingly need. Chronic diseases, for example, will become an increasingly important part of the Indonesian health system as people live longer. Wolbachia will free up resources to ensure that problems like those can be fully addressed as they become more prominent. Finally, we'll have a discussion, and Dr. Ida will moderate that. So we want to thank everybody involved, the World Mosquito Program that has provided us with data, the Tahia Foundation that's been supporting this, the Gates Foundation, which is supporting part of the World Mosquito Program, as well as supporting our cost-effectiveness study, and colleagues at the London School of Hygiene and Tropical Medicine that have worked on a partner study related to disease modeling. So again, thank you for the chance to talk, and I'll look forward to the feedback from my colleagues.